This is sort of a loaded topic, but we're going to try to put some teeth into it. Keep in mind this is a bit of a generalization, but while it misses the bullseye, it accurately hits the tree. As with our other videos, this applies to the entire US healthcare environment, whether you're in Miami, Florida, Spokane, Washington, or Colby, Kansas. To level set, if you've seen our other videos about doctor compensation, doctors are paid differently depending on where they work and who they work for. That is, doctors employed by hospitals are generally paid differently than doctors who are in private practice. In different videos, we delineate what measures are used to pay doctors in hospitals and how doctors in private practices are paid. Generally speaking, when you think about doctors' salaries, you have to consider doctors who are employed by health systems or hospitals, and doctors who are self-employed doctors in private practice. As noted, we'll get into that a little bit later. With this video, not only are we trying to disabuse people that all doctors are millionaires, but we want to give a basic general sense of what doctors earn. This doesn't include side businesses, just what they earn by treating patients and practicing medicine. While all doctors make or should make more than $100,000 a year, people should understand that becoming a doctor requires a load of schooling, and generally, attendant with that education is the associated med school debt. So while you might look at $100,000 to $150,000 yearly salary as a lot of money, think about paying off $250,000 to $300,000 in medical school debt, trying to buy a home, start a family, buy a car. That should rightly change your perspective a little bit. Basically, doctor pay ranges depending on the following key factors: employment status, hospital or private practice, medical specialty, family practice versus specialist, the competitiveness of the practice in their market, and patient volumes. Each of these components works together to deliver a market-based compensation rate, for instance, what the market will bear. Most often, primary care doctors, family practitioners, or internal medicine doctors make a little bit less than a specialist like a cardiologist, ophthalmologist, or urologist. Generally, family practice and internal medicine doctors earn somewhere around $200,000 to $375,000 a year. However, specialists may get paid between $325,000 to more than $1 million a year, depending again on the specialty and practice location. In a later video, we'll consider how doctors generate money to help you understand the finances involved in your healthcare. As I've said, doctor compensation has a lot of variables and depends on a lot of moving parts. However, the data in this video does paint for you a pretty accurate picture. Remember, this is a more complicated discussion that seeks to cast a wide net around doctor pay. Doctor pay is never a one-size-fits-all equation. At Cubed, our goal is to educate consumers and offer a broad picture of what some of these compensation arrangements might look like. Remember, these videos are not meant to answer all questions precisely. There are simply too many compensation plans throughout the country. But they are directionally accurate across the United States. Just remember, some nuance exists geographically. Healthcare really is local. To understand more about doctor pay or suggest topics you'd like us to consider, please subscribe, like, share, and if you have any questions, email them confidentially to questions@cu3bd.org. Stay tuned for our next educational video.